Why would holistic practitioners want to incorporate microcurrent into their practice? Well, I think it really is it's kind of a match made in heaven for this condition. Whenever someone tells me they have arthritis, I'm always looking that arthritis is likely going to be the easiest condition that we're going to be able to actually deal with. Hello, everyone. Welcome to our next TSI 10-minute training. I'm Dr. Rob Vanbergen, and today we're going to be talking about arthritis and kind of the mechanism behind it and what it is that we can do to help solve it as practitioners. Now, arthritis is an extremely common, yet very complex and often debilitating condition, and it affects so many people worldwide. It's probably the number one thing people come to us with here at Pain Free for Life. This is characterized by joint inflammation, stiffness, and pain, and it can significantly impair daily function and overall, really, quality of life. So, traditional treatments, including pharmaceuticals and even surgical intervention in some cases, these often focus on symptom relief rather than addressing the underlying causes of the condition. So, from a holistic perspective, however, we're kind of looking at true potential healing, which really requires addressing the root causes of this condition and even looking into the causes of the inflammation and the cellular dysfunction as well. Now, one of the most promising modalities in this regard across the world is, in fact, microcurrent therapy, which we are already using substantially. And this is a non invasive bioelectric approach that just supports the body's natural healing mechanisms. Ultimately, microcurrent is using gentle electrical currents that mimic the body's own bioelectric signals, and it has shown to promote tissue repair, reduce inflammation, and alleviate the pain, which would be associated with the inflammation that is in the arthritic conditions. So, what I want to talk about here today is the scientific mechanisms behind arthritis and the role of cellular dysfunction as well as inflammation, and how microcurrent therapy can really work to provide a holistic solution for arthritis sufferers. So, arthritis is not a single disease, but it's rather an umbrella term encompassing over 100 different conditions that affect the joints. The two most common forms are osteoarthritis and rheumatoid arthritis. So, you'll see these as OA and RA often flown around among patients and doctors. Now, both of these have distinct pathological mechanisms, but they share common features such as joint degeneration and inflammation. So osteoarthritis is probably the most common, and this is often kind of referred to as kind of your wear and tear degeneration. This is primarily a degenerative joint disease caused by the breakdown of cartilage, which is the flexible connective tissue that kind of provides a nice little cushion for the joints. Cartilage loss leads to increased friction between the bones, resulting in pain, stiffness, and reduced mobility. Now, the progressive loss of cartilage in osteoarthritis is driven by an imbalance between anabolic and catabolic processes. So, this is, so like in a layman's terms, so this would be like the building and the breaking down, I guess, processes in the chondrocytes, which are the cells responsible for maintaining the integrity of the cartilage. Over time, the mechanical stress, the oxidative damage, the inflammatory cytokines as well, and our tumor necrosing factors, which we know we can shut down with vagus nerve stimulation, these contribute to the degeneration of cartilage, and in some cases, even the formation of bone spurs, which can be very, very painful. Now, when you compare this to rheumatoid arthritis, rheumatoid is kind of completely different because this is an autoimmune attack on the joints. Now, RA is an autoimmune disorder in which the immune system is mistakenly attacking the membrane, the lining of the joints, causing chronic inflammation and joint destruction. And this can be fairly rapid in my experience, depending on how severe the RA is. So pro-inflammatory cytokines play a major role in the inflammatory kind of cascade that leads to joint damage in RA patients. And the persistent immune activation in RA leads to some other issues as well. In fact, a formation of kind of an abnormal tissue that actually then begins to erode cartilage and bone, which makes the dysfunction of the joints even worse. So in both RA and OA, chronic inflammation is playing a central role in disease progression, and it's really pushing a cycle of tissue damage and impaired repair mechanisms. And this is where microcurrent therapy can be kind of really beneficial because it helps to modulate the inflammation, and we can also enhance the cellular repair. Looking at the different frequencies we see from joint repair to all these different tissue types, we have so many options in what we can do with microcurrents at any given time. Now, microcurrent works by delivering these extremely low level electrical currents. These are in the microamp range, hence microcurrent. And these mimic the body's own bioelectric signals. Many of you know this, that's why you're here. These microcurrents have been shown to stimulate cellular activity and enhance the energy production and then reduce inflammation, which makes these devices a very effective tool for managing arthritis holistically. So microcurrent can reduce the production of these pro-inflammatory cytokines, which helps to control the chronic inflammation associated with arthritis, which is leading to that damage. So by promoting the release of the anti-inflammatory mediators, microcurrent is helping to restore a very balanced immune response and prevent the excessive tissue damage. Now, it also enhances ATP, and one of the primary mechanisms of microcurrent therapy is its ability to increase this ATP production, which is adenosine triphosphate. This is the energy currency of the body, and it's essential for cellular repair and regeneration. Studies have shown that microcurrent stimulation can actually enhance ATP synthesis by nearly 500%. This leads to improved tissue healing and regeneration. Now, improving circulation and nutrient delivery is incredibly important as well. Poor circulation in arthritic joints, this contributes to stiffness and slow healing, and microcurrent promotes microcirculation, ensuring that oxygen and nutrients reach the affected tissues. Now, enhanced blood flow here, in this case, also facilitates the removal of metabolic waste products, which reduces swelling and promotes faster recovery. And of course, there's that pain reduction as well. Now, automatically, by getting rid of those pro-inflammatory substances in the body, you're going to be helping with pain. But in general, pain reduction and nerve modulation, microcurrent helps a lot in further reducing any lingering pain. And it really does this by stimulating the release of endorphins on the one hand, which are the body's natural painkillers. And it also influences nerve activity, right? It helps to normalize pain signaling pathways and to reduce hypersensitivity in arthritic joints. So, why would holistic practitioners want to incorporate microcurrent into their practice? Well, I think it really is it's kind of a match made in heaven for this condition. Whenever someone tells me they have arthritis, I'm always looking that arthritis is likely going to be the easiest condition that we're going to be able to actually deal with. Now, really what we're looking at for practitioners looking to incorporate microcurrent is to take several considerations into account, right? First off, check into the patient's medical history, right? Arthritis type, find out what you're dealing with because that's going to dictate your treatment protocol. There's a lot less need for vagus nerve stimulation if the patient is dealing with osteoarthritis than there is if they're dealing with rheumatoid arthritis. Now, additionally, looking at complementary therapies as well that can help, like those we teach in the Hache protocol, but others as well. Nutrition, stress management, these things support the healing process. Make sure you personalize the microcurrent protocol. Looking at exactly what exactly is going on with the patient is going to determine what you do. For example, the evolution is going to almost be the benchmark here as your bare minimum device for dealing with any arthritis because it has the regenerative capacity to do so as well. From the anti-inflammatory modes that you have in all of our devices, and then adding in fMRSI, which allows the regeneration of joint tissue, is going to be huge. But looking at what the patient needs and where they are is going to be key because severe arthritis that's caused considerable joint damage, there may even be an absence of inflammation at this point, and you have to kind of determine and analyze that, which of course you can do with the Pinnacle looking at the screen. So, what other things can we do here? Well, combining it with other holistic modalities is important as well. There's only so much that any one treatment can do by itself if something else is out of balance. And microcurrent can be effectively combined with dietary interventions, with herbal medicine, with acupuncture, and movement therapies to provide a comprehensive healing approach as well. But also encouraging your patients to look into the lifestyle factors that they may be inputting, stress and sleep quality for one, but even things like smoking that could be causing further immune damage as they go. So, the management of arthritis, a kind of complex underlying condition with some simple microcurrent solutions, requires a fairly multifaceted approach. And we want to go beyond the symptomatic relief to address the underlying mechanisms of inflammation and joint degeneration, right? And that's really what microcurrent allows us to do. And it's scientifically backed in doing so, which helps the confidence of the patient and the practitioner. For those of you committed to holistic healing, really looking into integrating this therapy into your practice can provide patients with an incredibly powerful, non-invasive tool to restore joint health and overall well-being. And honestly, as research continues to explore the therapeutic potential of bioelectric medicine, I know that we're going to keep staying on the forefront of that because we're constantly innovating and we're constantly seeing more and more how, as much as you look at other types of energy medicine, microcurrent is that natural, innate system within your body. And we just need to activate it and make it work. All right, everyone. So thank you for joining me today. Hopefully you found this informative and helpful. If you tune in next week, we'll be back for another 10-minute training. So take care all. Bye-bye.